Tell us that story about you had mentioned you were on one of those online dating services and you had put your photo up before the transplant and after. Give us a little insight on that.
Well, okay, before I came out here, I knew I was going to use Hasson Wong. Okay, you guys were kind of booked out there, so I was like 6 or 8 months before I could even come out. I got back in the dating scene. I was divorced, so I was back in the dating scene, and a friend of mine said to join one of those dating sites. So I took some pictures, and the only pictures I could take of myself was without hair. So I had a friend of mine help me out with that, and we put together a profile on a dating thing. And this particular site could actually count how many women will click on your picture and open you up and look at your profile.
Right.
Okay, so they scroll down, they find you, they think you're good looking enough, they scroll on you. I got about a couple hundred hits or so, and that was in a 2 or 3 month period, maybe even 4 months. And what's funny is that after the surgery, okay, my front, and it started to healed, started to grow in. Give it about the 5th month or so, and I took new pictures.
And you had quite a bit of hair up at the 5th month.
Oh yeah, it was nice, and I kept it short, and it was I liked it a lot. So I got on the site again, and at that point, of course, I was at about 400 or so hits. In a month's time, after I put the new pictures on, it went from around 400 to like 1,500 hits.
Wow.
Which means that women who click on you and they open you up and they want to see you, which kind of goes to show you that there's a little bit more scrutiny when it comes to the kind of men women are looking for. Mm-hmm. And I think that having that hair, even the short hair, to frame my face made a big difference in my photos.
Yeah, the way you look.
Yeah.
Yeah, excellent. So it was kind of a 2-surgery approach for you because you obviously had a big area to cover. You happy with the outcome as far as, the process? I mean, obviously, in a perfect world, you could have done it in 1 surgery, but obviously doing 8,000 grafts is very rare to be able to do in 1. Right. But how did the 2-surgery approach work out for you? Did you know that even after the first one, you're going to come back and fill in the crown?
Yeah, that was my approach altogether. Mm-hmm. I researched it. I saw what was going on, what other patients were doing, and what I wanted to do was a little different. I wanted to get as much as I could the first surgery and pack it in the front. Pack it in and bring it back
as opposed to maybe spreading it out a little bit farther.
Right.
You could still do 2 surgeries, but you wanted to do the front and the back.
Correct.
Because there is that approach. Obviously, you can, like I said, spread it out a little bit more, but it's not going to give you the same density in the front. But you like that approach.
Well, that was the approach that I decided to go with, and Dr. Hasson was fine with it. So I knew coming in my first day that I was going to be back within 9 months to a year. Doing the stretching exercises is a big deal.
Yeah.
That makes a big difference, and I can't stress that enough. So if you don't think it's a big deal and you want to wait till the last minute, I wouldn't. I would suggest that you get yourself booked and give yourself about 2 or 3 months of consistent stretching twice a day, 10 minutes a day, and that'll make a big difference in your overall grafts.
Yeah, and especially for patients that would have a fairly good-sized procedure the first time, the scalp does stretch out, but we take a little of that laxity out, so you can always get a little bit more if you do the stretching, and most patients would benefit from it. There's that odd patient that has such a loose scalp it doesn't matter, but you can never have it too loose, as we say.
Right.
Yeah. You're back here. Obviously, everybody out there seeing you and seeing your before photos will go, geez, what's he back here for? I mean, look at how much hair he's got. But you're hoping to do a little bit of temple work this time, and maybe fill in a little bit more in the crown. You just kind of put a little icing on the cake.
Right. I didn't know what my approach was going to be. I had an idea that I wanted to kind of thicken the crown up a little bit, but given the consultation with Dr. Hasson and the approach that we're going to take, yeah, I'm kind of excited. I'm going to kind of work on the temples, give myself a little bit of a subtle temple work, and I think the end result is going to be amazing.
Great.
Yeah.
So we appreciate your spending a little time with us, Bob. It was good to see you again. Any last words for anyone out there considering Hasson and Wong, and any advice you'd give them?
Well, I think the advice I would give them is take your time, do your research. Don't be afraid to talk to the patients of Hasson and Wong, because I'm available, with the with the website or anybody that wants to send me a question, a concern, or comment. But what I would suggest you do is just take your time and do your research, but ultimately make sure that you base your judgment off of results. Whatever it comes to money, it comes to travel, it should come to the results that you're going to get in the end.
Thanks, Bob.
Yeah.